Good morning. I'm Linda Reinstein, the co-founder of the Asbestos Disease Awareness Organization, and I'm so excited and delighted that you're joining us today. Just to be clear, ADAO has always been about education, advocacy, and community, and we have stood solid for 17 years with our principles. As we start this program, try to use the hashtag of 2020 ADAO when you go social. It'll give us the opportunity to connect and share all the great information that you're going to hear today. We've come a long way since 2005. And in this photograph, you're going to see my daughter and my late husband, but more importantly, you're going to see Barry Castleman, Dr. Lemon, and so many others who are with us today. ADAO's leadership remains strong and constant. We had a fabulous film festival yesterday, and today will be unmatched. In our academic conference and the award ceremony, there's so much to look forward to. Our first film festival yesterday, which we called Asbestos, Art Advocacy, and Shared Stories, was a success. And let me tell you, it won't be the last. We bring Dirty Laundry, The Mother, Breathless, and ADAO's 16th staff briefing. So information just flowed through our channels, and Julie Gunlock made a powerful keynote speech. And obviously, Christine, Dr. Oliver, and Ellen made excellent moderators. We shared our story. You're going to hear from Mavis soon, and we're all about sharing our story and coming together as one. Today, 8 countries will come together as presenters. And we are so excited about bringing Australia, Belgium, Brazil, Canada, Nigeria, Portugal, United Kingdom, and the United States together for this unique opportunity. There's over 40 speakers that you're going to hear from during Friday and Saturday. So get out your pen or your tablet and take notes. There is a link on the homepage where you're viewing this program right now, but just in case, you can see it at the top of my screen. Well, we just published our 131-page program, and we are proud of the information in there. You'll see the bios of our speakers, our honorees, and some gratitude, but also the tributes from family members, where this is an important opportunity for us to acknowledge and remember loved ones. As we acknowledge and remember, after 17 years, we are so close with many people, not just asbestos victims. We want to take a moment and remember these 7 individuals: Dr. Eula Bingham, Dr. Morris Greenberg, Paul Handley, Anna Marie Kearns, Mike Mattmuller, Ann Strickland, and Nigo from Brazil. These are all amazing people who have worked hard with ADAO to advance prevention and policy. Well, Ellen is probably blushing now in her pajamas because it's early out in California, but this conference would have never taken place without Ellen, who's ADAO conference co-chair. She gets up early, she stays up late, she is so patient and kind, and she does this as a loving volunteer. So Ellen, we thank you. Later today, you're going to hear from Rebecca Rendell from the AFL-CIO. She will deliver a powerful conference keynote speech. And then, as we started a tradition after our dear friend Andy Schneider passed away, Wendy Rudderman from Pennsylvania will deliver the Andy Schneider Memorial Lecture. She has uncovered through her investigative journalism a story about asbestos in schools that you won't want to miss. We want to recognize many people who make our work possible. And in the program, you're going to learn more about our honorees, former Congressman John Shimkus, Congressman Tonko, the strong American Federation of Teachers, all of the past R-Band supporters, Dr. Jackie Moline, filmmaker Judd Apatow, and of course, Barry Robson and Rob Sussman. So join us in the evening for that. Our work does require some money. Not a lot, because we work from a home office, but our sponsors recognize that the work we do is unmatched. And we want to thank our platinum sponsor, Simmons Hanley Conroy, our gold sponsor, new this year, the Gorey Law Firm, and our silver sponsor, returning year after year, Early, Lucarelli, Sweeney, and Meisenkoten. We don't make legal referrals, and these firms recognize that they want to be associated with ADAO because we are, as Barbara McQueen said, the boots on the ground trying to get this work done. Our ADAO leadership hasn't changed. For 17 years, we've had these amazing champions for our mission and vision. I'm not going to read all the names. They're in your program, but recognize the three boards, our big board, our science, and our prevention, come to the aid of ADAO all of the time, whether it's briefings or reviewing materials, or especially this conference. When it comes to art and advocacy, my dear friend Jordan is going to perform tonight. Art, advocacy, and shared stories is not new to ADAO. I've been working on this for about 17 years. When Doug Larkin and I co-founded ADAO, we knew that our sad stories about Bill and Alan needed to be shared, but we also knew there were others. So over the last 17 years, we have built a strong platform to blend art and advocacy, shared stories, and academia. My dear friend Earl Daughter will speak in session 1, and Earl is going to share some of his photography and experiences and knowledge. He is an award-winning photographer, but the poster that we're presenting, again, obviously with COVID, we're holding this one. It is entitled Art, Advocacy, and Academia, and you can see Julie in the top left and many other people. Earl will explain later. So as we move forward, I want to ask you to grab your cup of coffee, get really comfortable. You're going to hear from a mesothelioma warrior who's a champion, who's my inspiration. I start to cry when I introduce you, Mavis. She's a dear friend, and I love her husband, Ray. Mavis, could you make that international welcome happen now, please?
I would indeed. It's my privilege and pleasure on behalf of all the mesothelioma patients and carers around the world to welcome you to this ADAO 16th Annual International Asbestos Awareness and Prevention Conference with the Film Festival that was just wonderful yesterday. You will hear from more than 40 experts from 7 countries. Sadly, as COVID has isolated us and made travel so difficult, we have to have a virtual meetup, but that's not a bad thing, as more people are able to attend and share the knowledge of asbestos and mesothelioma as Linda brings her passion and knowledge to the stage. My asbestos story started in 1960 when I married Ray and washed his clothes. He worked in the dockyard as a shipwright, and asbestos was all around being installed or taken out of ships. There were no showers in them days, so you just came straight home and bathed, where I would then put the washing into the washing machine. All that dust didn't mean anything to us. We didn't know the dangers of the white dust that Ray had in his hair or on his boots. We were to find out in 2009 the damage that showed itself as mesothelioma when they drained 7 litres of fluid from my lung. No wonder I couldn't breathe. They have banned Asbestos UK, but that isn't so. That isn't to say we have, that isn't to say we are safe from its deadly hold on us. We have so many tons in old buildings. Our hospitals, schools, museums and colleges still have the deadly substance hidden in them. So we have surveys carried out so we can manage asbestos or remove it, and that costs thousands. Asbestos is not banned in the United States, which is surprising to many people, and yet they know the danger and are being sued for compensation. Haven't they got the message yet? Imported products from countries such as Russia and China may contain asbestos even today, and it is the only known cause of mesothelioma and is also linked to serious diseases including lung and ovarian cancer. You may not see an asbestos warning label on products in the US. There are a few reasons for this. Certain uses of asbestos do not require warning labels. Manufacturers are often not required to check whether talc is asbestos-free, which I find so hard to understand. I really thought the US ban would happen this year, but no, we still have to fight. Let our first voices be heard. Use our voices. I wish you luck and hope 2022 will be the year that compassion will reign. We need a safer world and we need asbestos banned. The government's knew asbestos was killing the workers, but they thought that paying out compensation wouldn't cost as much as money lost if they banned asbestos. How wrong they were. Asbestos had been banned in more than 60 countries, and yet asbestos exposure is the #1 cause of work-related deaths in the world. Approximately 90,000 people die from asbestos-related diseases globally each year. An estimated 125 million people worldwide remain at risk of occupational exposure to asbestos, and about 1.3 million US workers in construction and general industry are at risk of exposure today. When will we take charge and ban this material and make our world safer? My journey began in 2009 when I couldn't breathe as I went to vote in our local hall. That started 4 years of chemo, and then 2014-2016 Pembro immunotherapy. After 2 years of complete freedom, my mesothelioma started to grow again. I re-challenged the drug, and after a great start, the cancer got crafty and wiggled free again. To date, I have a very slow grower, so I'm on a watch and wait, which has been a help in these COVID lockdowns. Reaching my 61st wedding anniversary in June and 80th birthday, the 27th of August, has been a great achievement. And I thank the National Health for that. Running the Mavis and I Foundation with my board has been time consuming, but we are financing a Meso UK nurse and a research project as well as joining Meso UK and HASAG to finance the buying of machines for the PIPAC trial for peritoneal Basingstoke. I have one last message to the Meso warriors. Stay positive. I'm the longest living immunotherapy mesothelioma patient in the UK. We are beginning to survive, but we must ban asbestos throughout the world. Let's save the future's lungs. Thank you, and enjoy the rest of the day.
Good morning. I'm Dr. BradBlack from Libby, Montana, Center for Asbestos-Related Disease. And I would like to introduce our first speaker, Anna Forgy, who has been, her family has been impacted by mesothelioma, and she has a good bit to say for us. So I'll turn it over to her.
Thank you, Dr. Black. Hello, everyone. My name is Anna Forgy. I live in Washington, D.C., where I am a lawyer, and I should just say at the outset that everything I'm going to say today are my own personal opinions and views and don't reflect those of my employer. So as Dr. Black mentioned, my family and I were impacted by mesothelioma. My mom was diagnosed with peritoneal mesothelioma in April of 2016, and we lost her on May 4th, 2017. So she had about 13 months from her diagnosis to when she passed away. And this morning, you all will hear from several people on this panel with far more knowledge and expertise than I have about mesothelioma and about asbestos. I am not a medical doctor, but the panel is titled Progress and Challenges, and I wanted to speak about a couple of the issues that I'm aware of as somebody who was a caregiver and a family member of somebody who suffered through mesothelioma and then passed away from it. So one of the main areas of progress that I see in the issue of asbestos and mesothelioma is the awareness itself that the ADAO and others are bringing to the dangers of asbestos and the conversations that are happening as a result of the awareness that the ADAO and other groups are bringing to the disease. But that progress comes with its own challenge, and that is what the previous speaker was mentioning briefly, how to raise awareness not only of the dangers of asbestos, but of the existence itself of asbestos still in our daily lives. If you take an informal poll of your colleagues and friends and neighbors, I would imagine that most would tell you that asbestos is banned in the United States, and are shocked to learn that that is not the case. So the ADAO and others are working to change that perception. But I think one area of progress that we can all work on together is to continue to have those conversations and to encourage people to get educated on just how pervasive asbestos remains in our world and in our daily environment. And in conjunction with that, to continue to raise awareness of where asbestos is lurking. For my mom, the asbestos was in a body powder that she used for decades. It was the talc in the body powder was laced with asbestos, something she would have had no way of knowing, especially in her younger years when she was using that body powder. But for so many of us, we use items every day that we don't know. We don't know exactly what's in those items. And so I think that one of the most important things for all of us to do and is to really to challenge ourselves to investigate what is in the products that we're using every single day. Furniture, things you're eating, things you're breathing in, to really to challenge and to question the products and the items that are being sold to us and that are part of our daily lives. And that includes in pushing local elected officials. So if there's something that seems not quite right in your neighborhood where you live, if you feel as though your filter is getting too dirty too quickly in your home, or there's air that every time you're in that area, you tend to get a headache. Those are all things to raise to a local official to investigate, because there are so many contaminants lurking, and asbestos, as we all know, is one of the main ones of those contaminants. The other sort of challenge that I wanted to address today and speak about briefly in connection with the experience that my family and I had with mesothelioma and continue to have with mesothelioma is the challenge of having difficult conversations for patients who are suffering from mesothelioma, and the challenge of having those conversations for their friends and loved ones. And mesothelioma, I think as a lot of us are well aware, is a very sinister and dangerous disease. It lurks for years, it lurks for decades, as many of the medical professionals on this conference can speak to much more eloquently than I can. It's really something that can take you by surprise. And it's something that bursts on the scene, and it's often too late to really to have successful treatment for it. That's changing thanks to the medical professionals on this conference today and others who are not here. But it's something that, because it lurks for so long undetected, it can become really difficult. So one of the struggles that I faced was to figure out how to have conversations with my mom about the disease, and how to balance between keeping up her positive spirits and her hope, and how to have a serious conversation about life and what life what life would look like if she weren't here. So I wanted to sort of challenge everyone to and encourage you all to have those conversations with your friends and with your loved ones. And it's a difficult and different situation for everyone. It's something that can be guided by other family members, sometimes by therapists, by friends, but it's something that is very important to do. And sort of along those same lines, to really challenge and encourage everyone to have the difficult conversations with medical professionals, so that you can, in fact, push doctors for answers on things, push for subsequent tests, push for additional research into things, and really try to pursue those things for your friends and for your loved ones. I really just want to wrap up my comments by saying that my mom was 68 when mesothelioma took her away from us 4 years ago. She was an adventurer who never gave up, and she persisted relentlessly in pursuit of her dreams and in pursuit of the things that mattered in her life. She had an insatiable curiosity about the world, especially the natural world, And I think that the role of my section on the panel was titled Warrior, but I really think that my mom was the warrior in this fight. So she would be really proud of all the work that the ADAO and Linda and all of you are doing to really fight this awful disease that took her away far too soon. So thank you all for what you're doing, and I will turn it over to the next presenter.
Thank you, Anna. There's nothing more impactful than hearing from people that have experienced all the misery of having mesothelioma. So thank you. Our next speakers are Linda Reinstein, of course, are one of the co-founders of ADAO, and along with Raja Flores, who's chair of thoracic surgery at Mount Sinai.
I am the co-founder of ADAO, and I am so excited to share the highlights and progress that we have experienced in the last 2+ years since we met in April 2019, especially as ADAO dedicates the entire month of September to mesothelioma awareness. Now, this is the first year we've ever had our conference completely live streamed, and it is free around the world. It is important to ADAO to remove financial barriers to education. We believe this life-saving information should be accessed by everyone, and you will hear from my colleagues around the world later today that will reaffirm that. This is another way that ADAO stands up for health equity. We want that for all. Though we can come together in person, I'm hopeful next year we can. There are some great successes and amazing steps that we've taken forward in our prevention and policy work, especially with our art, advocacy, and education. But first, let's talk about the greatest challenges that we have to dispute. Both Anna and Mavis made compelling speeches and presentations about the information that swirls around that is completely incorrect. Let's be clear about this. There are 6 things. Asbestos has not been banned. There is no safe level of asbestos exposure. Imports and use continue. In fact, in 2020, more than 300 metric tons of raw asbestos were imported from Russia and Brazil. Each year, over 40,000 Americans die from preventable asbestos-caused diseases. Nearly 70 countries have banned asbestos, and I want to also explain that the FDA has jurisdiction over cosmetics and personal care products, not the EPA. So in starting my presentation about progress and challenges, I want to step back for a brief second. For those of you who I haven't met, I am a mesothelioma widow. And like many of you, I understand what Anna is saying about having those difficult conversations. We had to start those when Emily, our daughter, was just 10. I look at an empty kitchen chair now this morning. Alan died 3 years later after his diagnosis. Doug's stepfather didn't last as long as Alan. It made Doug and I angry, sad, and frustrated to know that imports continued. And that really started our work with ADAO. We have become a leading stakeholder in prevention and policy. We have worked with the EPA to help shape the Lautenberg Chemical Safety Act implementation. We work with Congress to move the Alan Reinstein Ban Asbestos Now Act, the acronym is RBAN, forward. And we have delivered educational information around the world with help from partners like Niosh. You'll hear from Simon later. So let's talk a little bit about RBAN, because our legislative and legal work has been spectacular, thanks to Bob Sussman and many others. RBAN passed out of the U.S. House of Representatives Committee on Energy and Commerce with a bipartisan vote of 47-1, November 2019. We were so excited that this really had a chance. However, it did not get the House vote it deserved, but the bipartisan momentum continues today. This is exciting. If you click open the link that you were given this morning by way of an email, you will find a letter inside the program from Senator Jeff Merkley. Let's start with some good news. His discussion draft, which is just that, it's for discussion, for the 2021 RBAN bill to begin the legislative process looks terrific. Yes, it will ban asbestos imports and use. It will study legacy asbestos in our homes, schools, workplaces, and even on consumer shelves. It's important. And lastly, it will improve EPA's chemical data reporting. The bill is also, and I know Dr. Black will talk about this, it also bans for the first time the Libby amphibole, windchite, and richterite that causes great health risk in Libby and beyond. Now, inside your program, you're going to find 3 letters. That's why the program was a little bit late being published. It was worth the wait to me. Senator Merkley, Daines, and Tester have letters in your program supporting the need to ban asbestos, but also a little bit of a welcome message to you as conference attendees. Yesterday, we actually issued a press release because we sent an open letter with our colleagues urging Senators Merkley and Daines to move this excellent discussion draft forward in the legislative process. Now, Dr. Brad Black is an expert in Libby and around the nation and world. You're going to hear an update from Brad. And while we still have strong bipartisan support and stakeholder support about our ban, we want you to know that we're going to need all of you to help ban the Libby amphibole and the other 6 fibers. Let's keep going. Even during COVID, ADAO hosted 2 congressional staff briefings, along with experts and victims that shared their story. If you were on yesterday, like Mavis, you would have watched our 16th congressional staff briefing with many experts that are on today. And without these briefings and our panel speakers and our experts, we have a hard time delivering the message to staffers and members who manage so many important issues in Congress. So our educational materials and conversations are critically important. Let's talk about legal. I never thought I'd say I would be suing the EPA, but we did. And here's what happened. We won. Thanks to Bob Sussman and our co-petitioners. According to our case, companies are now required to report their asbestos importation and use. Reporting is critically important to address the risks of asbestos to protect the health of every person in America from asbestos. And now we have legal standing, which means ADAO can use our organization, and the American Public Health Association also was recognized with standing. We can use our 2 organizations to advance public health policy and prevention, which is amazing. So Bob Sussman will give you more about this later this afternoon, but my personal and deep thanks to Bob, who works tirelessly with me to support ADAO's mission. So let's talk about the Asbestos Awareness Week. We have that championed by Senator Tester from Montana. And I know Brad's probably smiling there because you got a lot of muscle in Montana, Brad. Well, we've held 16 congressional staff briefings. We've championed 8 Surgeon General warnings. Those are also listed in your program, all commenting about the dangers of asbestos. And we have partnered for prevention with Niosh for Global Asbestos Awareness Week. We have taken education to new heights. We are very proud as an organization. We work closely with the firefighters, and there isn't anybody probably as a union that I have the greater respect for when it comes to a disaster. I had to call them many times when Alan was ill. They come with their knowledge and their hearts. With climate change and natural disasters, our first responders are having to step up more than ever before. These storms wreak havoc on communities in the US and around the world. If a structure is contaminated with asbestos and it is either damaged, implode, or needs repair later, if it has asbestos, there can be exposure. So we are working with another partner to release our new natural disaster campaign, so stay tuned. We're going to talk about best practices and government materials that should be accessed before a natural disaster. If anybody lives in Los Angeles, you may have felt the 4.7 earthquake last night as we were working on the program. I thought maybe that was Alan telling me I needed to stop working, but that earthquake made Emily and I run for shelter. That is what we're going to be experiencing more and more. So let's talk about our grassroots efforts about spreading awareness. And Anna commented about how important that is to raise awareness. We're constantly working with the media. We've been quoted, we submit op-eds, we even participated, we were asked to participate in an NPR 3-part series in the state of North Carolina called Asbestos Town, and they did an amazing job bringing the community together in this 3-part series. And it's important to know that when we have used asbestos and possibly the use has stopped, we leave a toxic dump behind and a community in peril. Oftentimes, it is environmental racism. These communities don't have the dollars and the legal counsel to muscle up. It's wrong. So let's talk about a few other things. And Dr. Frank was the first one to step up. We had to cancel our conference in March of 2019. It's no easy feat. Ellen and I and others had worked on it for over a year. We canceled and we thought, what next? Can we rebook in September of 2019? We saw the science and the data coming out, and we knew that it would be risky. But I called up Dr. Frank and I said, hey, Dr. Frank, we need to get our community together. Can we do a Zoom conversation about what people need to know during COVID? And of course, as Arthur always does, sure, Linda, no problem. Subsequently, we had 10 other conversations that talked about awareness, advocacy, education, human rights, and more. They're all online. If you can't find them, send me an email. Everybody has it. I'm really proud of our art, advocacy, shared story efforts. We have worked for 17 years on bringing together our stories. You can find them on our website. Anna, Mavis, our personal story about Alan, of course, Kim's story about, oh gosh, I just lost my Bill. You'll see over 200 stories. So we take our stories, and then when we have a congressional briefing, we link up each of those constituent stories to the member. We're able to say what you do in Pennsylvania matters. Listen to Marilyn Amento. So we link our stories to policy and prevention. We also use film and song. How can you just read statistics and papers? Trust me, I am all about the science, real science. And I know we need those peer-reviewed papers published. But as Dr. Selikoff said, statistics are just people with the tears wiped away. We know our stories are important. And I'm excited to pursue the next chapter of ADAO's educational efforts. And we have worked with Dr. Raja Flores in Mount Sinai in 2019 and did a session with his med students. I also worked with Dr. Christine Oliver, who aired Dirty Laundry, the film, at her university. So watch for more in this space. So it is tough to be a widow and see an empty chair and experience grief. Sorry, must be tired. But this will be the 5th time Senator Durbin will recognize all asbestos victims, past, present, and future, by flying a flag over the US Capitol at the request of ADAO. We need more representation in Congress. We want our stories heard. We want the experts to be recognized as just that, the experts. So when you look at our stories, I want you to think about what can you do to help in this movement. It is not a moment or a catchy phrase. It is a movement that will last until I am long gone. It will take over 50 years to clean up this man-made disaster. One thing you can do is connect to ADAO with our newsletter. You can help us financially by make a donation. You can share the conference proceedings with your colleagues. You can read the program and see what you think. And you can also support Eric Jonke from Belgium, who will be publishing his book soon about how asbestos impacted his entire family. Follow ADAO for more details. I can't lie, it has not been easy in the last 2.5 years. It hasn't, but we have made amazing progress. So this is a time to embrace hope, collective activism, and lace up your shoes for the ultimate marathon. This conference will inspire you, it will challenge you, and hopefully it will bring you up to help us in the next session. It is my greatest honor to introduce you by way of video to Dr. Raja Flores, ADAO Science Advisory Board member and a New York City mayoral candidate. He sends his regrets for not being here. He spoke at our August staff briefing. This is a message that everyone should see and share. I clipped his video with his permission. So if our team will roll Dr. Flores' video, we will then move on to our next speaker. Here's Dr. Raja Flores.
colleague, Dr. Raja Flores, a preeminent cardiothoracic surgeon at Mount Sinai, which is my alma mater. Raja.
Misinformation results in death, whether it's from COVID or whether it's from asbestos. And 20 years ago, when those towers came crashing down, misinformation spread just as fast. Lies such as the air was safe to breathe, asbestos levels were negligible. And the biggest lie is that asbestos was banned in the United States. Whether this misinformation was for political gain or monetary profit, I don't know. The facts are the air was not safe. Asbestos levels were dangerously high, and asbestos is still not banned in the United States. Since that dreadful day, approximately 2,600 more deaths have occurred over the past 20 years and counting. First responders continue to die, and this is unavoidable because of their heavy exposure. But what is avoidable is the continued exposure of innocent Americans to asbestos. Asbestos continues to be imported. It contaminates gaskets, friction products, brakes, roofing materials. It also contaminates children's makeup and crayons, and the list goes on. The truth is that asbestos is still not banned in the United States, and it continues to be imported. Legacy asbestos still lives in the walls of many of the New York City buildings, including public housing. And every once in a while, an unsuspecting construction worker, fireman, or tenant becomes exposed to this hidden, deadly carcinogen. But this life-saving information about asbestos not being banned in the United States is not nationally known. Many are surprised when they find out that asbestos continues to be imported, that it is not illegal, that asbestos is still not banned in the United States. There are those who profit from this misinformation, and people continue to die from this misinformation. American politicians have chosen to look the other way. Mesothelioma is a deadly cancer from asbestos exposure, and I cannot look the other way. It is a disease that I battle with every day in the operating room, cutting out cancer-ravaged lungs and other body parts for a disease that is 100% preventable. No asbestos, no mesothelioma. It is that simple. Congress, you know what's the right thing to do. Ban asbestos today and stop the continued death and suffering of innocent Americans. You can save more lives with the stroke of your pen than I can with the cut of my scalpel.
Thank you, Linda and Dr. Flores. We'll move on to our next speaker, who was a former Assistant Surgeon General of the United States and has had a lifelong career in public health. Richard Lemon. Go ahead, Richard.
Hello, and let me also welcome all of you to ADAO's annual conference. I am Richard Lemon, co-chair of the Asbestos Disease Awareness Organization Science Advisory Board, along with my good friend and colleague, Dr. Arthur Frank. I have researched the epidemiology of asbestos-related diseases for the past 51 years. And as Brad said, I'm a former Assistant Surgeon General of the United States, as well as the former Acting Director and Deputy Director of the National Institute for Occupational Safety and Health. We are all here today to support a ban on asbestos in the United States. The Alan Reinstein Ban Asbestos Now bill will represent a monumental public health achievement for the United States and its citizens by preventing asbestos-related disease to all of our citizens. Asbestos is a killer. It often kills in what appears to be a random pattern, affecting one and leaving another unharmed, even though they have similar exposures. We do not know why this happens, but it probably has to do with individual susceptibility or other circumstances unknown to science today. We do know that asbestos-related diseases are dose-response diseases, and as doses increase, the risk of developing asbestos-related disease increases. We also know that there has not been a dose, as Linda said earlier, identified below which some individuals are still not at risk of developing disease. As we attend this conference today, approximately 110 persons throughout the day will succumb to an asbestos-related disease. As Linda said, that's approximately 40,000 Americans will continue to die each year until a ban is enacted. Every one of these deaths are preventable. Unfortunately, these numbers represent only an estimate and are one that is clearly an underestimate because there are no nationwide surveillance systems in the United States that adequately capture the true nature of asbestos-related diseases. Let me give you an example. One of our premier surveillance systems, the Surveillance Epidemiology and End Results database, often referred to as SEER of the National Cancer Institute, has been found to underreport mesothelioma in some areas by as much as 80%. I am glad this bill provides language to address these deficiencies so that we will eventually have data to measure the true impact of asbestos and to determine if our public health efforts to prevent asbestos-related diseases are effective. As we see in countries that have banned or placed strict regulations on the import and use of asbestos, the trend of asbestos-related diseases is beginning to slow down. However, that is not true in the United States, who has yet to take the action to ban asbestos. While this country is still experiencing an asbestos disease epidemic, that continues to grow. It is shifting from occupational to non-occupational exposed victims. It is clear that all forms of asbestos, including chrysotile, which some call the safe form of asbestos, cause each of the several asbestos-related diseases. Proponents for the continued use of asbestos, however, argue that chrysotile does not cause mesothelioma compared to the other commercial fiber types. Keep in mind that chrysotile represents the most commonly used asbestos today and historically represents over 95+% of asbestos usage. So no wonder proponents of asbestos don't want to ban chrysotile. I asked, is this an argument? Is it scientific or economic based? I think we know the answer to that. I am pleased the Alan Reinstein Ban Asbestos Now bill makes no distinction and includes all commercial fiber types. And it also addresses the legacy of asbestos still in place in the US in buildings, schools, hospitals, and multiple commercial products, as we heard earlier. Passage of this bill will mean an asbestos-free America. And I can't say that enough. We want an asbestos-free America. Now let me switch gears for just a minute. I want to stress the need for regulatory agencies to change their counting methods for enforcement of including only asbestos fibers greater than 5 microns in length, because scientific data show that the vast majority of asbestos fibers are less than 5 microns in length. In fact, studies by Niosh, the agency I used to lead, show this can be as high as 90%. Why is this important? It has been found by multiple researchers in pathological studies that fibers most likely to penetrate into the lung tissue and move to the areas where mesothelioma occurs are the short fibers. Additional studies by Niosh on a cohort of textile workers predominantly exposed to chrysotile in South Carolina has added new information showing cumulative exposure to fiber sizes, including those less than 5 microns in length, were highly statistically significant predictors of lung cancer or asbestosis mortality. In summary, science has not exonerated fibers below 5 microns in length as a health risk, and on the contrary, what science tells us would indicate the opposite. Thus, it is time for regulatory agencies to reevaluate their sampling methods to address these short fibers of asbestos. Now I'd like to close my comments and thank you very much.
Thank you, Richard. So we will move on now to our next speaker, who's Dr. Arthur Frank. And Dr. Frank is well known to me, has been active in areas of asbestos for years and done it both in U.S. and internationally. And I will turn it over to him now to continue with his presentation.
Good morning, everyone, and thank you, Brad, for your introduction. It's always a pleasure to follow my friend Richard Lemon. Dick and I have worked together as co-chairs of the ADAO Advisory Board, the Scientific Advisory Board, and my time with Linda goes back to the earliest days of ADAO. She and I met at an asbestos conference in 2004 in Tokyo, and that became my entry into the world of ADAO. My own work with regard to asbestos goes back to my days as a medical student over 50 years ago when I trained with Dr. Selikoff and did my training at Mount Sinai, and have spent a career now studying the effects of asbestos. I have done and still do research and have spoken about asbestos, as Brad noted, literally all over the world. I've spoken and done research in such diverse places as India and Mongolia, China, Brazil, Colombia, and throughout much of Europe. The story of asbestos is one that continually needs telling, and I'm delighted that my dear friend Earl Dotter is going to be on the program with us and share his story in pictures, which are invaluable in sharing our understanding about asbestos. With many of my ADAO colleagues, we helped bring about the bans in Brazil and more recently in Colombia. It's interesting that Canada, a country that produced more asbestos than any place else, even decided to shut down its asbestos mines, and the fight there from our colleagues north of our border have been successful in bringing that about, though there are still fights that need to be made. Not only there are fights need to be made, but we still need to not only advocate about asbestos, but educate about asbestos. There is still a great shortfall in physician education. I see hundreds and hundreds of asbestos disease medical records each year, and I just hate to think of how poorly many of my medical brethren evaluate exposures, even when they see a disease like mesothelioma, don't necessarily recognize that this is indeed an asbestos-related disease. And there are many other conditions that go misdiagnosed, asbestosis among them, because of that shortfall in education. We still need advocacy. We learned about that yesterday for those of us that had the privilege and pleasure of participating and watching the film festival. We see that this is an issue all over the world. We know that it's still being fought in Europe. It's being fought in India, a country that I have visited more than 24 times, much of that related to asbestos. We still have a tough road ahead of us, both here in the United States, where the fight continues to have the Alan Reinstein ban asbestos bill become a reality, but also internationally. We know that countries like Russia and Kazakhstan and India and China, major either producers or users of asbestos, block educating the rest of the world about the hazards of asbestos. Not only that, these industries not only pay to have false science produced by unreputable scientists that masquerade as producing honest but truly produce dishonest science. And those of you, some of you may know, but for those of you that don't, some of these industries even send spies out among us. And they have literally paid hundreds of thousands of dollars to people to infiltrate organizations like ADAO and others. So there's still a guardianship that we need about the work that we do. It's unfortunate that it's a legal product here in the United States still. You know, has been mentioned, about 70 countries around the world have banned it now. But the fact that we buy asbestos and still import it into the United States means we're supporting other countries' industry. We've stopped being able to get it from Brazil because of the successful ban there, but now Russia is continuing to sell 1 million tons a year of asbestos around the world. That means that if we buy a product that kills people from another country, we are condemning others in those countries to death and disease because of our buying this product. We also have before us a growing understanding of the talc issue. We heard from Anna earlier about how her mother was exposed to asbestos. And we're learning more and more about the issue of talc. And we even see that companies that have been literally browbeaten into stopping selling asbestos-contaminated talc in this country continue to sell it in over 150 countries around the world. So we still have a lot to do in terms of advocacy. The last point I want to make is that the world still looks at the United States as a beacon for occupational safety and health issues, not as much as has been the case in the past. I've heard stories as I've sat in scientific meetings in Thailand or Sri Lanka, countries that I've lectured in or done work in. And they say, why should we ban asbestos? The United States hasn't done it. So for all the reasons that I and my colleagues have commented upon, we must work hard to continue to bring about the banning of asbestos here in the United States and to continue advocacy around the world to see that this unnecessary material becomes a relic of the past and is not something that is ever used again. Unfortunately, as Linda pointed out, long after I'm gone too, for the next 50 years or more, there will still be asbestos-related disease occurring around the world, even if we stopped it everywhere tomorrow. And that is unfortunate. So we need to get ahead of this and bring about the ban. So thank you for the opportunity and honor of speaking with you this morning.
Thank you, Arthur. So we'll move ahead now on this. Our next speaker, Earl Dotter, who I've known for quite some time now, and I'm always amazed of the power of the picture, and he's managed to bring forth incredible pictures of the hazard of the working person. That's a credit to him. So go ahead, Earl. Look forward to hearing from you.
Thank you, Ed. Thank you, Linda. It's always a pleasure to rub shoulders with my good friend, Dr. Arthur Frank in Philadelphia. I have been an occupational photojournalist for some 50 years now, and I guess it's not a surprise that by 2015, I'm a little late in this struggle to ban asbestos, but we began to present at the ADAO the exhibit Badges, a memorial tribute to asbestos workers. The photo ID badges of those who were unknowingly exposed to asbestos began to personalize that story that sadly on today. So I'm going to share my screen, and we'll, as soon as I can share my screen, then we will take a look at a little slideshow I've prepared. Art, advocacy, and academia is the theme of my poster this year. We see, as of yesterday, the artistic messaging power of film. That were the films that were featured at ADAO's Film Festival, as well as the advocacy, the direct advocacy of individuals like Julie Gunlack, have been an education for me. And I hope it reaffirms the messaging and the importance, the personalized stories that tell about the reasons the banning of asbestos is so important. It is no accident that this year's ADAO poster features Julie and many other individuals in direct action to ban asbestos. And by the way, when I asbestos warriors, out of caution, I may be only using their first names, but many of you know these individuals very well. See, Carmen and his daughters, they came all the way from Portugal to the ADA conference and are preparing a poster for the March on the Capitol. There's Julie again. We see Julie, Kim, and Jill. Filmmaker Daniel Lambo with Linda Reinstein and Bob Susman. At the previous film festival presented at George Washington's University's Milken Institute School of Health. At the screening of Breathless, you see David Michaels, former Osha director, speaking. Filmmaker Daniel Lambo and Linda Reinstein, warriors Julie and Maggie, and Linda leading the charge with Nicole Rich and asbestos widow Marilyn Amento at the ready. Carmen's family from Portugal, India, the United States, and Canada are well represented at the ADAO March. And Linda, Alan, and Emily are marching together toward Capitol Hill. The Field family and friends march in memory of Felix Brow Westbrook, who died tragically at the young age of 59. ADAO stalwarts Penny and here you see Nicole Rich. She greeted many who inquired when she marched to the Washington Monument. Many of the tourists in town were very interested in why she was marching to ban asbestos and provided details to those individuals. Nicole's husband, Tony Rich, was busy taking photos then. And a wall of asbestos ban solidarity with the Capitol. Again, asbestos widow Marilyn Amento with her children at the Capitol. Brazil, the United States, and India are tall with ADAO at the Capitol. And it is fitting this strong asbestos disease survivor and ADAO warrior closes my presentation. And I thank you very much.
Thank you, Earl.
You're welcome, Brad.
They're always impactful. It's always good to see these things. Nothing like seeing it in the picture to really bring it home. So we really appreciate your work. So I guess we should open things up for question and answers.
Thank you, Brad. You did a great job moderating, and hats off to all of the speakers. It is rare in an ADAO conference that we have one extra minute, and believe it or not, we can spend 10 minutes on Q&A. So we have a few that have come in from just the agenda. So let's start with a little bit of a conversation, as Anna talks about having some of our conversations, not only about difficult issues, but let's talk about what we can move forward. Arthur, what I hear from colleagues is what happens in the US matters abroad. Can you touch on our policy and how it impacts Asia and some of the other countries that you work in?
Yes, as I commented a bit earlier, even though the United States is no longer the leading light, if you will, for occupational safety and health, that's sort of been claimed by some of our European and Scandinavian colleagues. America is still considered an important place to look to. And when other countries see that we have not banned it, the simple refrain is, if you haven't done it, why should we do it? And it would help a great deal to get beyond the 70 around the world if the United States would now also ban asbestos. And that, I think, will bring many, many other countries on board about this.
I agree with you. Dr. Lemon, I have a question for you. You have a very distinguished career with Niosh. You understand how agencies think and move. Can you share a little bit to our viewers about how distinctly different the jurisdictions are? Like, many people ask us if with our ban bill, would FDA be able to ban talc under our ban bill? Let's talk about the jurisdictions for FDA, Niosh, and EPA, if you can bundle that up easily. I think that would help some of our listeners.
Well, Linda, I'll try. It's sometimes even difficult for us to understand the jurisdictions, but Osha was formed at the same time that the National Institute for Occupational Safety and Health was formed, with a bill in Congress in 1970. So we're fairly young organization, even though we're turning 50 years old today, which is hard to believe because I was there when we began. And so it's what we have at Niosh is a research agency. We research the diseases that affect workers and their families. What we have at OSHA is an enforcement agency that takes our research and research from others in the academic community and put it into regulations to protect workers. Now, the Food and Drug Administration, the FDA, has authority over drugs. It has authority over some devices, such as radiation devices, emitting devices, etc. And that is their jurisdiction. The Consumer Product Protection Agency, which is another agency you may or may not have heard of, has the authority to protect consumers. So they come into the asbestos picture and dealing with products that contain asbestos. And as you know, we've seen many of those products, and ADAO has highlighted that in Koreans, in a detective kit made in China, and many other products. So the jurisdictions are somewhat confusing to those that don't work in the federal government. So I hope I've given you some idea that these agencies do, in fact, work together. When I was with Niosh, we set up a committee called ONE. It was the OSHA, Niosh, EPA committee. And we met regularly to deal with issues, not only asbestos, but other issues that we all had common interest in. So the government does have mechanisms to work together. I think that committee is still going forward in regular communication between the agencies. And together, we hope we're able to ban asbestos after asbestos is banned, to take it and continue our work to further take steps as under our jurisdiction to deal with asbestos. That's a long answer. I'm sorry.
No, I think it's very important because it's complicated. So maybe, Richard, what we'll do is we'll write up a blog with Arthur and Brad and others, and we will differentiate the jurisdictions because there is confusion. And sometimes that confusion is used to oppose our ban. Anna, I know it's hard to share stories. I've been sharing Alan's for 17 years. I teared up at the kitchen table this morning. Those conversations are hard. Alan never wanted to know what was happening. Can you share? You're a very strong woman, and I know your sisters. Is there any advice that you gave your mom for how she could, how her journey, her treatment journey, and ultimately her into life journey? Because I think those conversations are hard. What did you and your sister do? Because I think you could probably help another conference attendee this morning.
Sure, Linda. And that's a great and hard question. And if if something I say does help someone, that would be great. But the truth is, it's really hard and it's really different for everyone. I think that one of the most important things to do as somebody who is sort of an outsider is, even though it might be your loved one, your very close loved one, you are ultimately an outsider to what is going on for that person. The most important thing is to really meet them where they are in the process. And so if the person says to you that they're just not ready to have a particular conversation at a certain point in time, to not fight that, and to kind of let things play out a little bit for them. But it is also important to try to find a time when they may be more open to having a conversation. So sometimes it might be, immediately before a doctor's appointment, where you can say, preface it with, well, we're going to go into this appointment. Let's talk about the questions that we have, and really gear those toward what kind of treatment they're looking for. And then other times it might be just when you're, out and about, or just at home, spending some time together. And really trying to find a time where you can balance between giving them the positivity and the hope that you want them to have and that you feel, but also to encourage them to think about some of the harder things that are going on, which of course is hard in and of itself, because it means you yourself have to be confronting those difficult things. And so it's multi-layered in terms of difficulty, but to the degree that we can all really try to focus on putting ourselves in the shoes of the person who's going through what they're going through, as difficult as that is, I think that's really a way to try to have those conversations, and also to encourage them to talk to other people. So it may be, I think in my case, my mom didn't want to feel like she was burdening my sister and me with the concerns that she was having, and the fears that she had. And so, if they have a close friend or a spouse to whom they feel like they want to talk about, or a therapist, or even just a neighbor who maybe has had a similar life experience, to really encourage them to have those conversations, and then to not pry into those and let that be their space. So hopefully those are all ideas that could help someone.
I think so. I see Dr. Frank wants to share. Dr. Frank, you're muted.
Thank you, Linda. I just wanted to add a bit to that. One of the things that I do, and I've been doing it for over 40 years, is have been engaged in the world of medical legal evaluations. I've been looking at hundreds, in fact, over the years, thousands and thousands of charts of asbestos victims that have come to my attention from attorneys. Doing this, I've seen that every penny of fees that I might otherwise have been paid have gone to my universities, but I'm there to try to help people. That's another part of the conversation that is often difficult to have. Yet families have suffered very often financially, as much as insurance may pay for some things, that it doesn't always cover all the costs. And that some folks, say, look, I worked for this company for years. They did well by me, but so I don't want to sue. I think that those can be difficult conversations sometimes, and people need to think not so much for themselves, but for the families that are left, that nobody would rather have the money than the person, but it does help and balances the cost that sometimes comes with the care that insurance won't completely cover, and it pays for some of the true emotional costs that people go through to deal with these kinds of issues.
No, those are important points. Earl, I have a question for you. Brad, you're going to be in session 2. I'd like to make a suggestion that you and your colleagues carry on the conversation about how we talk about end of life or meet a patient where they are. Because for us as families, and I know you're very sensitive, Dr. Black, from being in Libby, Montana, is that we as patients and family members have a difficult time talking about these things. Alan always said he would never be ready for hospice. and he never engaged in hospice. I might have been, but he was terrified. And I think there is a terror about dying. And Alan's comment was always, I want to die with dignity. So we had a hospice doctor scheduled to speak in session 2, and unfortunately couldn't join us. But I think we should be bold enough and brave enough to carry on the fact that our physicians should be able to guide us with good information and facilitate those conversations, because it is hard for everyone. Ann and I could probably burst out in tears. So I'd like to carry that over, Dr. Black. Earl, my dear friend Earl, he has trudged around that camera all over. And if you look at that smile, you know the guy's heart is just as fabulous as that smile. Earl, we've worked together since 2015 through the ups and the downs. You have photographed conferences, briefings, marches, the Bracey's family. We've driven all over the country together. This is a hard question. You're an award-winning photojournalist, and you are my dear friend. So I love you. There's no wrong answer. Over the course of the last 6 years, do you have 3 of your photographs that you might have featured in your poster, or something you didn't, that you just want to touch on? Because not only is the photograph amazing, but that moment is amazing. Share, please.
Thank you, Linda. As the visual guy in this group, think of the Matt Mullers and Riley's first birthday. My wife Deborah and I were able to share a celebratory moment with them as their daughter had her first birthday. It was a good time. It was a happy time, and it was a personal time. And so I encourage every one of you to, with your cell phones, really enable film clips and opportunities for still photos to document those intimate moments. We don't have to have our bicycles from one coast to the other, to what Zach Johnson and Connor Lewis did in Dirty Laundry, but we can begin to record these moments that will be precious to you and that you can choose to share with everyone else at ADAO. Thank you, Linda.
No, that's a beautiful. I was staring over my family, the pictures of Alan with Emily that we had done. Who knew back then that those would become some of my most treasured memories? So you're right, Earl. And thank you for walking alongside of us, leading us and listening, because that's huge. Okay, Dr. Brad Black, before you jump off, I got a question for you. You're from Libby. I think I want to move there where there's blue sky and clear airs. Tell me a little bit on the personal side of being in Libby. You've known Les Gramstead and some of the mesothelioma warriors and warriors in general. When those crosses go up in the graveyard, when I went there years ago, that was an astounding visual for me to see and feel that personally. What do you do with your patients at the card clinic? How do you best help them work through their possible anger, fear, and anticipatory grief? I know that's kind of a loaded question as a physician, but I bet you can answer it.
Well, I've learned through time as a clinician and a physician and a person that's a friend of the family, which is always hard to balance because objectivity is key in our work. But I've found that there may be very few things we can do, and many physicians are uncomfortable with that and tend not to engage with the patients after there's really nothing they can do, when in fact that's when they really need you, is when there's nothing left to do. They need you. They need that support. It gives them confidence. It makes their days better. And when you do that, it's just, it's amazing. And you don't realize the power you have to help a family when you think you're not helping them. And I've learned that over time. And I got to tell you, as you know, I've been in Libby since 1977. I know virtually everybody in the community, and they know me. And I know what they've been through, a very unfair situation here. And we all missed it. And now we're trying to make up for what happened. And it's all about why bands are important, because by the time you see this disease, it's too late. And so the least we can do for our patients is to be there for them and to help them through the disease processes that we can't do anything about for the most part, but that's not true because there's many things we can do to make their disease much different than it ends up being. So yeah, you have to remember that as a care provider. I think that's something that has been, a lot of physicians never get that opportunity. And unfortunately in Libby, I did. And with the repetitive situations with patients dying of asbestos disease, an example, you'll have a family, father dies of asbestosis, the mother dies of mesothelioma, and now I'm taking care of their son who is in his mid 60s and has advanced asbestos disease. These are family histories in Libby. So you have to get in with the families and work through it. They've endured it once, they've endured it twice, and 3 times. This is how it happens in Libby because of the pervasive exposure to so many people. And of course, it's just, those are hard things as a physician, but you've got to hang in there because you realize you are helping them when you're not sure you are. So
you have a very gentle style, Dr. Black. I'm sure that you bring great comfort and information. It's going to wrap up, but Earl, I failed to say that you have 6 posts. Is it 5 or 6? I'm getting old now. 6 posters?
It's
5? 5. So
5 posters right now.
Let's make sure people know before we wrap up the conference how they could purchase one or the entire suite of 5 photographs, because your work is really beautiful and important. Brad, I'm going to stop talking. It's all yours to close. My thanks to all of you, because we kind of fly by the seat of our pants every now and again, and you guys were remarkable, as I knew you would be. Thank you. Brad, it's all yours.
Well, you didn't tell me they had this time to talk, but you did mention something about some letters from Senator Daines and Tester. Is this a time that we might introduce that, or what did you plan on there, Linda?
Yeah, I just wanted you to know we actually held the program to get both of your senators to have letters, and I sent them to Dr. Markowitz, since I know it's a little hard to read, but I just think the community that you have built in Libby, you suffered greatly. You now have, it's not new, but they've been stalwart champions, and I think having your senators engaged as they have been about asbestos awareness and prevention. Libby is unfortunately a tragic example. And I just wanted you to know that your senators stepped up really because of you, Brad. People love and respect you. And there are 2 letters supporting the work that you and collectively everyone have done here.